computer is okay. So, hello, Lynn, and thank you for coming today. And tell me, how can I help you today, and with what I can help you today?
Awesome. So I just want to thank you for being in my life previously and helping me with the healing sessions,
My
and
pleasure.
it was so amazing, and it's been a while, and I came today because I have a pain that won't go away. And as I'm a chronic pain patient, and
Yeah.
um, it's I love this realm, um, more holistically and spiritually to help try and heal what's here. And so that's why I'm here today.
Great. Okay, so uh, tell me, where is the pain or a symptom that I can help to heal now, basically.
So it is actually this neck, like from here, like the base of the skull,
Okay.
down in the muscles, and it's for the medical community here, it's been chiropractor and injections and physical therapy, and it's been about 5 or 6 months, and it's not working.
Okay, Lynn. Well, I'm gonna try to do my best. So another question is now, what is the level of pain from 0 to 10? So we need to somehow quantify it so I understand the tools I'm using for energy channeling, which one works the best. So zero, I need you to think of the number and give me the number from zero being like no pain, and 10 being the maximum pain. What is the pain in your neck right now?
It's about an 8 because it's constant. It doesn't go away.
Eight.
It doesn't
Eight.
go away. So like I can't. This is about as far as I can turn to the right,
Right.
which isn't very far. Right, the left when I move it. So as a human and walking around during the day or picking stuff up, it's like it's always here.
All right.
So I put
So,
creams and topicals and pain stuff, and just it won't go away.
all right. So I'm going to ask you now to sit really comfortably on your chair, relax, and close your eyes. And for a few minutes, stay like that, and then I will ask you to see if there is any change in the level of pain, and we continue like that till it goes down to zero, hopefully. So it's on your left side, right?
Yes.
It's funny in the camera always.
Nice.
All right. Okay, Lynn. Lynn, see what is the level of pain now, please. Can you
It's
move the
definitely,
head? All right.
yeah, definitely better.
Okay.
That was very interesting.
Sorry?
That was very interesting.
Did you feel anything at all?
Yes, I felt like it was like a radar scan. I could feel you going here and around my head, and
Yes.
then checking the whole body down the legs, and then coming back up. And I felt, it's gonna sound interesting, but I felt a lot of like uh, uh, garbage, kind of like faces or whatever. So my solar plexus was painful. Um,
Okay.
but I think, and then I saw this whole, right before we end, I saw this whole step thing of stairs going up to like take stuff up. But I could feel like the kind of like smoothing. I could feel definitely the
So you
energy.
felt energy really well. Was it did it feel cold or warm? Because some people feel sometimes cold or warm.
It wasn't cold or warm.
It
It was
wasn't.
just, it was almost like I don't have animals, but like a petting of,
Okay. Okay.
touching, like kind of like a, like a,
Stroking someone. Okay, that's the first time anyone told me that. That's interesting. Okay, so what is the level of pain now? Because we said before we started it was 8. What is it now?
I would say a 5.
5? Okay.
Yeah,
Okay.
it's like still,
Yeah. So what kind of is it's a spasming pain? It's like a
I think it's a spasm that won't go away.
right,
So I think it's muscle, and
right.
all the treatments that I've had, and even like muscle relaxants and all that I tried. Um,
Yeah.
topical creams I'm trying now, just for pain. Um, it's just it's stuck. It's like a stuck.
Okay. We're gonna try again, okay? Hopefully we can do better than 5 now. I hope so. So close your eyes and relax again one more time for me. Lynn, let's try again. Let's see. Let's move it and see.
Oh, wow. Wow. It feels really good. I can move. It's been so long since it's been released. I feel good.
Good. So what would you say now that this level of pain, where is it now? Do we
It's
still have pain?
just a little like I mean, this turns all the way. This is like a 1 or 2, but look how much better.
Yes. And
I
the
can,
spasming thing is still there? The
it's been
spasm?
here. It's been here for so long, like
Yeah, but
5.
is but is it still there?
It doesn't feel as like big and tight.
No? Flexible and good? Well, you can sure move your head, it says anyway.
I could feel, and you could probably watch this again. I could feel like when you were at whatever sending the energies there because you can see my eyes wince and like I could feel myself turning my head, yeah,
Wow.
involuntarily, but
Okay.
to be able.
That's interesting.
Oh, it feels much better.
Okay, what would you say it is? Let's quantify that so I understand.
I would say a 1 to a 2, so minimal.
Sure. Okay. Now, do you have pain anywhere else? I can fix it, try to fix it now.
So for some reason for this,
Mm-hmm.
the solar plexus kept kicking in.
Okay.
So I don't know if, I mean, I always have low back and neck pain and arthritis. It's just a symptom of the decade of the 60s, I guess. um,
That's
but I don't know if this was tied to a solar plexus. Would that make sense?
yeah, a lot of trauma removal happened when I was also
That's
channeling.
what I felt like demons, like ugly faces, right? Like
Okay, no, I didn't see any of that, to be honest. I I never see any of that. But
that was
and
it was like just the faces, but I could just
maybe
feel.
that's what you saw. Okay, that's
Yeah,
great. That's
yes.
fine. That's fine. But I removed a lot of trauma from your heart. That's for sure. I did work on your heart as well because I felt it was connected. So I worked on your heart area, chest area as well. And
Thank you, because that has been sealed and hardened for so like my whole life to
okay.
protect, right? And now releasing, in the ego mind in the past couple years, I think all my karmic paybacks actually. I think I'm done, and so now it's just like me, to all the things that were attached to the trauma
Yeah,
inside. Yeah.
a lot of the times it is a trauma, but sometimes it's just a lifestyle choices. People eat wrong things or drink wrong things, and too much of that. It doesn't happen once or twice when someone is having a wrong kind of lifestyle, like eating a lot of sugar, etc. For many, many, many years, then these things arrive as well, and it also could be because of stress and trauma
And the
or
attachment.
combination. So
Yeah, I agree with you on the foods. I'm not the best.
yeah, if you are suffering with arthritis and um and the pains in the joints or the back, as you said, the best is to, I mean, I'm not going to do the naturopathic lecture here. Just gonna say that no dairy, no gluten, no sugar of any kind, and yeah, and and lots of water. Hydrate your body well but and correctly and within few weeks if you just do that, that will yield a lot of results and you will see huge results already, just by changing what you eat. I mean, no soda drinks and none of that. I mean, we can. I'm happy to take you through that and how to hydrate your body some other time. But right now, I just want to, you know, um, focus on your pain and trying to relieve some. Okay. Anywhere else do you have pain? Do you have pain anywhere else?
So from previously of you working with me, chronic, so there's chronic low back, like the SI
Okay.
joints and all that for
Is that
years.
a slip disc? Is that a herniated disc, or is just a spine? Or is it the
It's
injury? I can't remember.
it's like degenerative disc disease is part of
Okay.
it, but my back blew out almost in the 90s, mid 90s, and it feels like SI joints. You know, I do a lot of physical therapy, which helps, but
Yeah.
it's just local. It's what's been interesting is like on the side of the spine, the two areas that have the bone, like
At,
it stays local.
okay, that's fine. What is the level of pain right now, would you say there?
You know, I'm so used to chronic pain. I'm just going to say, like, you know, like probably a constant 6 today, but as we're
Constantly. Wow.
moving, it was like an 8 or 9 the other day, like it's all
Okay.
day for 2 days. So it's,
Wow.
you know,
Okay,
just
so that's six. So at the very bottom, basically, at the bottom of your spine, around your back, yeah?
there's two kind of at the where you're before you're, you know, in this, I think it's this, that sacral, the SI joints, the joints that are right next. So if you go to your spine and you put your hands
Yeah?
on each side, there's like a bone there,
Yeah.
that
That.
area, that
Could you,
state.
if you don't mind, would you stand up and just show me where it is exactly? Because I wanna
So,
understand. Right.
right.
Okay, gotcha. Gotcha. All right.
And then, you know, and then
Where else? Tell me.
the
Where
neck
else?
is cervical. So like the lower part of the cervical, C4, C5, C6, like, you know, these three down here.
Okay. Right at the bottom of your head? Like,
It's kind of like in the spine. So it's like that.
okay.
So where
So,
this, yeah, where this hurts,
yeah,
chronic is kind of like low. So
at the
it's not,
right back.
yeah.
Okay.
So it's
And
kind of like, oh, like,
no problem. Okay.
like here
We're
to
going to
here,
try.
right?
Not
This part.
not to worry. Okay, so basically at the neck here and at the bottom, I understand where it is. So at the bottom, you said it was 6 on the scale,
And
and
neck,
what is it
neck,
at the neck?
same.
Same. So
That's been the same for
okay,
decades. Yeah.
okay. Let's see if we can
Okay.
help it. Yeah. Okay. Close your eyes and relax.
Are you okay?
I'm fine, fine. Most importantly, how are you feeling now?
Awesome.
Really? How's the pain in the neck? First, in the back.
It's like I can feel all the crunching, so it's moving. It's like release. Um, it feels, this feels really good.
Yeah? There's still, there was a two there at the
Yeah.
last.
You
Still
know what
there?
I think it is? I think it's just the muscle stretching. It doesn't feel like the pain. I think it's the movement of,
Okay.
you know,
So
be-
also with the inflammation, it will maybe take a little while before the inflammation completely goes out. You
yeah.
see, and
Well,
then there will
yes,
be, then you will feel nothing. You should afterwards. I hope
yes.
really.
This isn't really pain. It's more lack of movement in the body, like
Okay.
that. And then my neck is actually moving. It feels clearer. And my low back, I feel good. That was a very nice.
Okay. What is the neck? You said it was six, but before we started, the neck
Yeah.
was six. What is it now?
Just because it's sore, it's probably like, and just here, like just like a one or two, but it's just, I think it's just a sore muscle.
Okay, doesn't
I
matter.
don't,
I'm gonna do it again. And what about the back then?
it's it's a little sore, could be because I've been sitting,
Okay.
I don't know.
Okay. Do you want to get up and walk around a little bit to see if you can wake up the pain? Well, not that I want you to be in pain, but I just want to see if we have progress or not.
It actually, I feel good.
Yeah.
My back always hurts. Um,
So what
I'm
is
a
the
tough,
pain? What is the pain now? What would you say?
like a four, like better,
Four.
but
Yeah, but little,
sitting
only
down,
little bit. Wait, I'm gonna do it again. Yeah. You're making face, so I see it's painful. We're gonna
sorry. I'm a,
no, no, don't
I'm a tough
apologize.
one. Like,
Whole point of this is that I try to help you. That's
it's
all.
amazing.
It's my pleasure. So okay, so we still have two in the neck and we have four now in the back, right?
Yeah.
Right. And on the side it's gone. Okay, so back is
That's for sore. That's, I can feel the muscle. It's a muscle.
yeah,
It's
okay.
a muscle that hasn't been stretched
Okay.
in some time. So yes, I think the pain is gone. I think this is the muscle itself that
Good.
now it can move. So of course,
Great.
it's getting to.
Okay, so I'm gonna focus now on your back at the bottom, all right? Because that's the worst part, I think. Lynn?
Um,
Let's see how much pain there is now in your neck at the back.
it feels good.
No pain
And
in the neck?
mm,
Nothing?
just a, just the
You
muscle, little
just the
muscle.
muscle that you feel it. Okay,
That's
fine.
it. Yep.
It-
That's, I mean, I can move my head. Like
yeah.
you saw at the beginning, it was like only this far. Um,
Okay.
and
And at
then
the back?
yeah, on my low back, what I could feel was my back, like the being like pushed forward, like
Yeah.
it was, I, and then just very light where it took all the pressure kind of off the body.
Excellent.
That was very strong. That was good. It
Okay,
feels
so
good. It feels good also.
what is the pain level of pain there now? Let's
I don't think I
quantify.
have the pain. I think it's sore. Does that make sense?
No, sore is not soreness is a pain, no?
No, to
No.
me, it's been clenched for so long that
Okay.
when the pain is opened, these things all have to stretch.
All right. So
So I
there is
feel I feel it's more structural, not pain.
all
It
right.
feels so much better.
Okay. So basically no pain anymore anywhere.
Correct.
Would you say that? Is that what are you saying? What you were saying? Okay. However, anyhow, I have put a lot of energy into your back, neck, and the muscle here and the shoulder and around chest area, all your body, in fact, and the spine as well. So, and what we're going to do now is we're going to see, just give it 24 hours, okay,
Okay.
and see what happens. That's the real test, and maybe a couple of more days, okay. Possible that would be great if it doesn't come back at all, but if it does come back, I would like you to take a note and see, is it the same pain, is the same intensity, or is it less?
Okay.
Or and how long do you stay basically completely pain free as well? And if you notice anything else, would be nice to you to drop me an email and or you know or write it for me in the messenger.
Put
Write
it
it
in
for
the
me in the
group.
messenger. That
Okay,
would be
fast.
great, you
Okay.
know. And then I then then we can take it from there. And if it's necessary to do more, we'll do more. All
I
right.
so appreciate you. It's been way too long. You do great work, and I know that
Thank you.
that was a lot in here. I'm aware. So thank you immensely.
Oh, my pleasure, really, my pleasure. But since I saw you last time, it's been like 3, 4 years, and I've changed a lot, and it's been a hell of a ride for me, you know, changing countries, um, you know, learning more about healing, energy, etc. So, you know, and you see that my style has changed dramatically. It's completely what I do now is totally different. I still do what I used to do before, but yeah, this is kind of
This is great.
uh,
It's extremely helpful, and that's this is the future. So for not pills and no pain and releases and living life with joy and health and abundance.
exactly. Yeah, that's what we are hoping for. That's what I'm hoping for everyone. Everyone.
Forget exactly for everyone. It's just been
Correct.
really tough, even several years for many people. But
Yeah,
thank you. I'm so grateful.
you're very
I'm so
welcome.
grateful. And it's
It's
all
been a
right.
pleasure.
Thank you. Thank
Okay.
you.
Bye.
All right. Bye.